Thank you everyone for joining the webinar today. The topic today is responding to COVID-19 reports from the field. My name is Khadija Jordan. I am the Development Officer at our ICMC Inc. office in the United States. I'll be facilitating today's webinar with our Secretary General, Monsignor Robert J. Vitillo. He is the Secretary General of the International Catholic Migration Commission. Monsignor Robert J. Vitillo completed graduate studies in theology as well as clinical social work and management. He is a Catholic priest from the Diocese of Paterson, New Jersey in the USA. He has served in the Catholic Church related charitable agencies at the diocesan, national, and global levels. Between 2005 and 2016, he coordinated the Caritas Internationalis delegation to the UN in Geneva and served as its special advisor on health. In June 2016, he was appointed to serve as the Secretary General of the International Catholic Migration Commission, a global network of Catholic bishops' conferences engaged in response to people on the move. ICMC also provides protection and humanitarian assistance to refugees and migrants in emergency situations with 500 staff in 40 countries around the world, and we convene civil society and several major global migration-related advocacy networks. In addition to his leadership of ICMC, Monsignor Vitillo serves as an attaché for the permanent mission of the Holy See to the UN in Geneva. He has served as an advisor/consultant and has authored books and articles related to child protection, humanitarian assistance, global health issues, migration and refugee movements, global pandemics including Ebola, HIV/AIDS, and tuberculosis, spirituality and health, and Christian-Muslim dialogue. And I would just like to welcome our Secretary General, Monsignor Robert J. Vitillo, and hand it over to him.
Hello, everyone, and it's a real honor to be here. I'd like to start out with talking about ICMC for a few moments. You can see from the slide that we were founded in 1951 by Pope Pius XII. And that was very much encouraged by a very saintly American gentleman, Mr. James Norris, who dedicated his life to his family, but also to all of the poor people in the world, and especially to the refugees and migrants in the world. And he encouraged Pope Pius XII to start an organization that would network Catholic organizations and Catholic bishops' conferences to be able to work harder for refugees and migrants throughout the world. And you could see in the slide that we were called to protect and serve uprooted people, including refugees, asylum seekers, internally displaced people, victims of human trafficking, regardless of faith, race, or ethnicity or nationality. So we'll now talk a little bit about the current situation of COVID-19 in the world. And in some ways, you probably are tired of hearing about this. But just to give you a quick glimpse, and these are the latest statistics that were reported by the World Health Organization here in Geneva this afternoon. Globally, there are 2,500,000 confirmed cases and more than 172,000 confirmed deaths due to COVID-19. In the U.S., where many of you are from, there are 800,926 confirmed cases and 40,073 confirmed deaths. Right now, that's the highest rate of cases in the world. Some of the impacts, I don't need to tell you, you're experiencing them, the serious impact on economic growth, social relationships, healthcare infrastructure in most of the affected countries. Also, the fact that the food and agricultural sector will be affected. The World Food Program the other day predicted that some 250 million people will be suffering from severe food shortages because of this problem. And then also these effects will continue for several months and even for years. So now we'll talk about the impact on refugees and migrants more specifically, because that's our mandate and our priority as ICMC. First, some background. About more than 80% of the world's refugee population and nearly all of the world's internally displaced people, or IDPs as we call them, are hosted in low to middle income countries. That's a revelation to a lot of people who live in higher income countries who think that there are lots of refugees and forced migrants in their countries, but that's not the case. And many of those lower and middle income countries have weaker health and water, sanitation, and hygiene systems, and are dealing with multiple emergencies, including war, abject poverty, and environmental degradation. Refugees and displaced people in camps or crowded urban slums face a higher risk of getting coronavirus. And the population density of camps in the countries that are will be most affected can expect the transmission rate to surpass those of the Diamond Princess cruise ship, where 706 people tested positive for the virus in only 30 days after the first test was performed on board that cruise ship. And just to give you an example of the kind of density in these camps, in Syria, 68,000 people are living in the Al-Hol camp, where one person must live within a tiny space similar to that of a single car parking space. I don't know about you, but I can't imagine having to force everything that I have and do into that one space. And then in another camp on the island of Lesvos in Greece, approximately 1,300 people share one water tap and live in makeshift shelters and under sheets of tarpaulin. International migrant workers are also being deported and losing jobs by the hundreds of thousands in many countries and by the hundreds of millions in India and China. Just today, I received an email from a religious sister in working with some of those migrant workers that were sent away in the country of India at literally a moment's notice, without any help for travel expenses, and many of them had to walk hundreds of kilometers to try to get home. She wrote to me and said, "Father, we're doing all we can just to give them something to eat because they're stuck where they couldn't get home, they couldn't walk anymore, and we're having to struggle to give them something to eat each day." Blocking entry of seasonal agricultural workers will result in food shortages in Europe, North America, and Australia.
Thank you, Monsignor, for that great opening and for setting the stage for what we're seeing today and a lot of the issues that refugees and migrants may potentially face. I'm just going to ask you a few questions here that we received ahead of time. What should the ideal global response to this crisis look like when it comes to refugees and migrants?
Well, first of all, we need to make sure that refugees and migrants are afforded the same kind of help that the general population is afforded in the countries where they're living. And in many places, including the United States, refugees and migrants are not covered under any kind of health protection. And so that makes their situation all the more vulnerable. In places where they're living in camps, many times health services don't even exist in those camps, and they're not allowed to leave those camps now because of lockdown situations. So the big thing is to make sure that they have education and understand the way that the virus is transmitted and try to prevent that transmission, but also that they have the help that they need to be able to get assistance if they are beginning to show the symptoms of COVID-19.
And do we have any sense of how many refugees and migrants have been infected thus far?
We don't have any sense of that yet. We really don't have a good picture, but we do know that because of the conditions these people are living in, once the infection starts to literally rage in these places, that it will spread like wildfire.
Another question is, what are local governments doing to protect migrants and refugees?
Well, I can tell you that those policies differ. In some places, they are considering the refugees and the migrants just as they consider their local populations. In other places, they don't care. And I think the most dangerous reaction is when refugees and migrants are blamed for bringing the infection. And so I think that also not only deprives them from help, but it also makes them exposed to violence and to further marginalization. It also makes them more afraid to seek help because they know that they're being blamed for the infection.
Absolutely. And then just one final question for this section. Are refugees and migrants doing anything to protect and educate themselves?
Well, yes, they are. ICMC, but I'm sure many other church-related organizations and civil society organizations always try to involve the refugees and migrants in whatever situation they're in to help themselves and to help those around them. Both people in the local communities, the host communities, as well as their own refugee populations. And so we in ICMC are involving the refugees and trying to get them to help us to educate others, both family members, other refugees and migrants, and people in the local host populations about the situation of COVID-19, how it spread, how to prevent its spread, and also what to do, how to recognize some possible symptoms of COVID-19 so that they could seek help. One example of that is in Malaysia, where in general we've formed a refugee protection corps to help us with the refugee population, mainly Rohingya refugees, and to prevent sexual and gender-based violence, but also now to help us prevent the spread of COVID-19 in those communities.
Perfect. Actually, you already started moving into the next section, so I'm just going to take us there. Moving into how we're responding. This image is actually from one of our programs in Pakistan, where there is an educational program happening here with some staff members, and you see that some of them are wearing PPE and they're practicing social distancing. But I'm now going to hand it back over to the Monsignor so that he can give a little more context on what it is that our different sites are doing.
So first of all, we keep the safety of our staff and our beneficiaries, of their families and the local communities at the heart of all of our ICMC policies. In Pakistan, in addition to the education that Khadija just showed in the photo that she displayed, we also have continued to keep our medical services in ICMC clinics at camps along the border of Afghanistan. And one of the first things I did was to authorize the purchase of personal protection equipment for our doctors and our nurses in those clinics. I wasn't quite sure I would get funding to be able to buy that, but luckily the government funding, or the European Community funding, then later told us that they would reimburse us for that personal protection equipment. And then in lockdown situations, which are the case in most of the countries where we have field offices, the ICMC staff has really made heroic efforts to maintain contact and services with the refugees and migrants whom we serve. And I'll just give you a few practical examples of that. I already talked about our Refugee Protection Corps in Malaysia, but also in Malaysia, our staff is developing internet-based tools to prevent domestic violence among the Rohingya and other refugees affected by the lockdown. We know how difficult it is to especially be in a small apartment, maybe with small children, and to try to prevent anger from breaking out. And so we're calling this program Peace at Home, and we're trying to help them understand the ways that they could cool down and make sure that violence doesn't break out in the home. Our Jordan colleagues are applying for special permits to make home visits and thus be able to deliver cash assistance and other daily living supplies to the refugees who are in lockdown, both in camps and in the urban centers. In 40 countries of the world, we have legal and social experts working with the United Nations High Commissioner for Refugee offices there to examine claims of asylum and applications for refugee status. So they're continuing those interviews remotely. through smartphones and through computers. And we also help with translation. And then we offer special protection for unaccompanied refugee and migrant children and adolescents in Jordan. In Greece, in addition to our legal and social services, which we're doing remotely, we also send protection experts into 2 of the refugee camps in order to monitor conditions there and to intervene on behalf of the most vulnerable refugees, especially the unaccompanied children. And our staff are volunteering to take turns to do that since they know that they put themselves at risk. We try to make sure they have the protection equipment, but they are at risk, and so they're taking turns to do that. Also, some of the other things that we do, we inform and educate refugees and migrants about prevention. I've mentioned that already. We assess domestic violence and other forms of sexual and gender-based violence, and we make referrals for trauma therapy and shelter when it's available and when it's indicated. We update the refugees about their applications for refugee status and about resettlement to a third country. Presently, all resettlement departures and travel have been postponed, so we try to give them counseling support during this time of uncertainty, both as a result of the violence, the virus, but also as a result of not being able to find solution to their basic problem, which is the forced displacement that was put upon them. And finally, we continue our fundraising. We continue our efforts to raise both private and institutional funds so that we could respond directly to the COVID-19 impact worldwide among the refugees and the migrants. Also, continue to advocate both at the global level and then at national level through our member bishops' conferences and other partners for policies and laws that offer health care and economic support to all, especially to migrants, refugees, and IDPs without regard to their status. And we appeal particularly for the release of people from dangerous conditions in detention and the improvement of risky camp and urban living conditions, and to relocate unaccompanied migrant and refugee children from camps in Greece. Our Holy Father has been also advocating for that, and as well as a number of Catholic organizations that have been working together on that. And we're happy to announce that an initial small group of these unaccompanied migrant and refugees were accepted by the country of Luxembourg recently. And I know the Archbishop of Luxembourg has been very, very strong on that. We also promote entry and safe working conditions for international migrant seasonal workers and allowing humanitarian workers like our own to deliver needed cash and daily living supplies to vulnerable migrants and refugees while still respecting social distancing and personal protection regulations.
Thank you, Monsignor, again for updating us on how we're responding. I'm just going to dive into one of the questions from the chat box, actually. Monsignor, you briefly touched upon some of the protective gear that we were able to purchase for Pakistan with the reimbursement from the government. But someone wrote, if we're able to provide PPE products, how do we ensure they get to the right people? And how do we prioritize who gets them first?
Very good question. Of course, you hear a lot about the shortages of PPE products. What we're doing, certainly in our medical clinics, we've made sure that we bought gloves, goggles, and masks and gowns for our doctors and our nurses there, and also, of course, sanitizing fluids that are so necessary. For the refugees themselves, most of them are not able to come into our offices right now, and we're not able to do home visits yet, but we hope that soon will change as the virus levels and the number of people who have been affected go down. When that happens, we will make sure that we're equipping our staff that would not be doing medical work, but would be visiting and talking with the refugees or receiving them into our offices to be sure that they and the refugees are being given masks so that there's less chance of transmitting the virus through the droplets from the upper respiratory system. How do we know that they'll get to the right people? Well, we're working directly with those right people, and so we will prioritize that. But we also try, wherever we have field programs, not only to help the refugees and the migrants, but also to the needy people from the local host community. And that's a major principle in all that we do in the world, apart from COVID-19. But we're still doing that also in Pakistan in our medical clinics. Because many of the local people, the health clinics that the government has are closed, so they're coming into our camps and we're trying to help them. We worry sometimes about getting overwhelmed with that, but we realize that we need to help and we do help. And we pray that God will give us the strength and the resources to do that.
Thank you. Our next question is, what new approaches has ICMC created since the pandemic, and how will they remain in place after the crisis ends?
Another very good question. Certainly, I think we've become more creative, both in our headquarters and in our field offices. Some of the people who were not very prone or interested in communicating remotely are now doing that, or they can't communicate with us at all. And you know, certainly I have to say, I think that we've had some very positive experiences with most staff working from home, and yet we still keep our communications. We've also, I learned very quickly that as I convened remote staff meetings, that I needed to take the time to hear how people were doing with this, you know, by working from home and their concerns for their family members and for others, as well as our concerns for the refugees and migrants who remain at the center of all we do. So we spend a lot more time sharing feelings with each other than we did in the past with more business-like staff meetings. So I hope that's one thing that will continue after most people can go back to work in the offices. And then some of these new creative ideas of, you know, for example, the Peace at Home training tools that we're doing with in Malaysia, or trying to prioritize and maybe alternate who will go out into the field, especially since we expect that the risks will still be existing for a time, even after governments may be saying that it's safe to take full activities at the offices again.
Thank you. Thank you. And you've kind of actually began touching on this, but we have a question asking how staff members are doing in the midst of this. And, you know, it is a difficult time, and we do need to think about our staff and people delivering the services.
Thank you for asking, and that certainly is, as I said, that's something that we're taking much more time to hear about in our staff meetings. I just came off a staff meeting, senior staff meeting with some of our managers throughout the world, and so we are listening, and we also want to be very respectful again as we go back into this reopening phase that's happening in some countries and hopefully can happen in other countries throughout the world. Although the biggest impact in the poorest countries hasn't even begun. So we are listening, and we're being sensitive to that. And also then I know that our people in the field are also equally sensitive to what's happening in the families and in the local communities of the refugees and the migrants themselves.
Thank you. We're just going to move into our next section regarding the church's global and local response.
First of all, I can't start anywhere except with our Holy Father, Pope Francis. His own direct pastoral witness and leadership, I think, is such a strong signal, not just to us Catholics, but to all people throughout the world. and also some very practical responses. His COVID-19 global response team, where he has teams of people working on looking at the impact of COVID-19 right now, and also trying to project the impact long into the future, but also to ask the deeper questions, which he already asked in his encyclical Laudato Si, of what happens, in the future. Do we just go back to what we thought was normal, which was quite abnormal in terms of what we were doing to our environment, what we were doing to each other? Or do we really make some deep changes in our economic, our social, our political situations in the world, and our spiritual situations? So I'm working in one of the working groups of these response teams. We're studying deeply. We're reflecting on what that means in the light of Catholic social teaching, and then we're trying to offer some practical recommendations to share with the hierarchy in our church, with our Holy Father himself, but also to others who are involved in ministry and who are people of goodwill throughout the world. And then the Global Support Fund that the Holy Father has opened is also very important in helping the church respond at the national and the local levels. And then there's the whole area of remote worship. We already had televised masses and radio masses for what we called shut-ins, people who couldn't leave their homes, or for the very frail elderly. But I'm not sure any of us ever imagined that almost all of the world would be worshiping remotely for a period of time. And that's something that we've done. I was asked to help some experts at the World Health Organization design some guidelines for religious leaders on this. And I have to say there was great interest from these experts to be sure that they involved religious leaders and people who were working on faith-based programs because they knew the kind of influence and the credibility that we have. And then also the kind of pastoral care that continues, even though bishops and priests and lay leaders in the parishes cannot all go out to visit homes. We're finding the ways that we could do that remotely. And it's been very interesting to hear about the experiences in this regard. Then there's also the direct prevention, education, and care and support in the local communities of faith by religious orders, by church-inspired organizations, by the clergy. And now I'm hearing from a lot of clergy in Africa and in some of the other low-income countries about what they can and should do because they know that there will be a terrible impact of this virus among the poorer communities throughout the world. Since the outbreak of this pandemic, Pope Francis has constantly reminded us, both the members of the Catholic Church and all people of goodwill, that the novel coronavirus outbreak is a trying time for everyone, but more so for those on the margins of our societies, like migrants and refugees, who are often the most vulnerable. Thus, he urgently appeals to us for solidarity, and I'll quote him here. "We are in the same boat, all of us fragile and disoriented, but at the same time important and needed, all of us called to row together." So I hope that this message of rowing together, of solidarity, of caring for the most vulnerable will be resounding throughout the world as we continue our response to COVID-19.
Thank you, Monsignor, for that final section. Just going to dive into questions now. So my first question I have here are, what are Catholic social teachings about refugees and migrants, and can we get these facts out to parishes?
Excellent question. Certainly we have much teaching around the Catholic Church's policies and practices and beliefs in terms of reaching out to refugees and migrants. And we have the practical examples, the work that's being done with refugees and migrants in the United States by Catholic Charities throughout the dioceses. That's how I first got involved in working with refugees and migrants, through my own work in Catholic Charities in my own home diocese. We also have the work that's being done at the National Bishops' Conference level by the Migration and Refugee Services of the United States Conference of Catholic Bishops, and the kind of advocacy work and coordination work that's done at Catholic Charities USA, and the overseas work that's done by Catholic Relief Services in the United States. Similar activities go on throughout the world, and they're great examples to us in terms of putting into practice the gospel values that we learned from Jesus himself, who reached out to the marginalized, to the people who were refugees and displaced in his time, and then also that has been done and modeled throughout history by the Catholic Church and by many of the practical actions that are taken by the major faith traditions throughout the world.
Thank you. The next question is still related to the church's response. How are church agencies communicating with each other and sharing practices and responses?
There have been a lot of joint responses that are going on among Catholic organizations, but also on the ecumenical and the interfaith level as well. Also, the work that I mentioned in terms of collaborating with the World Health Organization in developing guidance documents for religious leaders, faith-based organizations, and communities of faith. We involved many different faith traditions to develop those guidance documents, and those are available on the websites of the World Health Organization. We also, in ICMC, we've been keeping close contact with our member organizations and our faith-based partners throughout the world and sharing good practices. We ourselves on our website, icmc.net, have a COVID landing page where we share a lot of these good practices and a lot of the articles and the experiences that we're hearing from our partners, our faith-based partners from throughout the world. And then we also are very, very grateful to the migrants and refugee sections at the Vatican in the dicastery for the service of integral human development, since they've gathered us together to discuss these situations and to share our experiences. And they put out also a newsletter on those experiences every couple of weeks.
Thank you. And just one more question within the church's response. Monsignor already, gave us a quote from Pope Francis, but, he's been very vocal about this. Can you tell us more about his personal concern and how maybe it relates a little more to his encyclical? You also talked a bit about that, but if you could expand.
Yes, thank you. I can't say that I've been privileged to discuss this personally with him, but I think any of us who have seen his face during the audiences that he gives during the Angelus blessings and now the Regina Coeli prayer and blessing, and especially during the rites during Holy Week, know of his deep concern, and any of us who witness the extraordinary Urbi et Orbi blessing and reflections on March 27th know of his deep concern, and his understanding, his personal sensitivity to the suffering of people is so evident, and I hope that it inspires us to do much more and to care much more ourselves.
Thank you. So one of the last questions I see here, which I think is very important, is, would you speak more to ICMC's experience with governments, during this pandemic, given that some have closed their borders and even stopped reviewing asylum cases? What does ICMC expect in terms of government commitment to durable solutions moving forward? And if you can specifically speak to some of the differences between Europe, Australia, the US, and Canada.
Maybe if I could just very quickly finish the answer to the last one, because I forgot to mention about, Laudato Si and whether that gives us any guidance on this, and it certainly does. ICMC has been very much involved in working with a number of Catholic and other faith-based organizations throughout the world to look at the impact of Laudato Si on human work and on the future of work. And now we're doing that especially from the lens of COVID-19. We're doing some reflections and we're doing some webinars specifically on that. But I mean, I think the intuition and the genius of Pope Francis in looking ahead and looking at the situation and encouraging us to re-examine our relationships with the world around us, with the environment, with each other, and with God in the encyclical. Really, in a way, we're almost previewing what's happening with COVID-19. And so, again, when he asked, "What are we going to do afterward?" and that's what this response team is trying to envision and make recommendations about, and also the papal preacher Father Cantalamessa during his homily to Pope Francis and to the world really during the Good Friday services at St. Peter's said the same thing. What will we do afterwards? And the worst thing we could do is simply to try to go back to what we were doing exactly the way we were doing it before. So I think this also gives us some inspiration. Then in terms of our experience with governments during the pandemic, certainly we've respected the requirements of the governments in the countries where we're serving because we know that they're being done with motivation for public health safety and reducing risk. But at the same time, we have been raising the questions around, for example, in one of the countries where we're responsible for giving cash assistance to the refugees. And now if we can't visit them and interact with them, we can't give them the cash assistance. And we know they need that assistance to be able to survive. So we're trying to make special appeals to that government to let us go out into the field, to be very careful, to reduce and mitigate risk, but to be sure that we're helping the refugees to be able to buy food and to provide for their families. And then we continue our advocacy around being sure that, first of all, that those refugees who, those people who are forced to leave their countries because of persecution or threat to their life still have a chance to be able to claim asylum somewhere. And the closing of borders has severely threatened that. We've joined with many other civil society organizations to address letters to governments about this and to make sure that people will be able to present an asylum claim in keeping with the governments, most governments of the world who signed the Geneva Convention of 1951 regarding the claim of asylum by refugees in other countries. And then we're worried about the durable solutions. Right now, as I said, all of our resettlement processing, both resettlement to the United States and now to Europe, are closed down. So we're continuing the interviews. And the governments have allowed us to do that because they hopefully are motivated to be sure that we could continue the work with the refugees and try to find third country resettlement opportunities for the most vulnerable refugees once all of these lockdowns have been resolved. But we certainly are continuing our work to make sure that will be possible. We hope that governments will not use this as an excuse to stop immigration and to stop refugee resettlement on a long-term basis, because we are very, very concerned to make sure that we could protect, especially the most vulnerable forced migrants and refugees, and especially to protect the survivors of human trafficking and gender and sexual-based violence. Just
2 follow-up questions to that, Monsignor. You talked about, a lot of countries are in a lockdown, and that's a part of the reason why we've seen a halt to admittances for our asylum cases that we're processing, even though we're still doing it. Can you talk a little bit more about what we are preempting and what we might be doing in the event that we are able to resettle people? Certainly, we'll still be in a space where we still need to practice social distancing, but how will we communicate some of this, even post this current state that we're in?
Thanks for that question. And in fact, yesterday I was on a long call with our people in Turkey, where our largest resettlement processing center is, to try to look ahead. First of all, they are processing these claims. I should clarify that in terms of asylum, those people who are seeking asylum, at least a recognition of their asylum, already have crossed the borders. Yeah. But we're worried now as borders have been closed. But we're still trying to work with UNHCR to look at those claims and to they have them recognized as refugees so that they could have special protection under the Geneva Convention. We also were talking with our staff about what happens when we can reopen the office. Again, working on being sure that we have the personal protection equipment, both for the refugees and for the staff. Right now, they're trying to order that, but it's hard to find it in many countries. But they're already looking ahead to that time. And then also, we'll probably have to limit the number of people who could come to the office at any one time. We also are talking about maybe having staff come in shifts so that they also could be conforming with some of the social distancing rules that probably will be staying in place for several months or maybe even for years.
And then that next follow-up question here is there anything we can do for host communities? Are they facing local hostility out of fear of their contacts with refugees?
Well, yeah, as I said earlier, we serve the host communities as well as the refugees in many places. And, Pakistan, as I mentioned, one of the things that we do in Pakistan, which has been put on delay now, is that we do livelihoods training. So we help people acquire skills and accreditation in those skills so that they could work and be able to support their families. In that place, at least 30% of the beneficiaries of this are local people who are poor and unskilled workers. And so we will continue that when we're able to reopen that livelihood training. That also cuts down on the kind of xenophobia and the marginalization of refugees, where many times in the low host community, the poor people in that community feel that refugees are being treated better or get more privileges or help than they do. So we will continue that. And as I mentioned, in Pakistan, in our health clinics, we're now allowing some of those locals to come for medical care since the health clinics in their own communities have closed as a result of COVID.
Thank you, Monsignor. I'm going to just ask one final question here. What are, one or two things that everyone on this webinar and everyone that, might hear of this webinar can do to support and help ICMC during this time? And I'm actually going to connect it to another question that was asked in the chat box regarding how we can use some major gift funds in this case.
Well, thank you for that, and thank you for the interest in that. Certainly, ICMC, as I mentioned, continues to do both private and institutional fundraising to keep afloat our ongoing programs, and we're afraid that with some of those programs, even though we've already been given grants by governments or UN or other multilateral organizations, that some of that funding may be reduced because of the postponement of some of the activities as a result of the lockdowns. So we continue to try to do private fundraising. Also, we're applying for some institutional additional fundraising directly to respond to COVID-19, especially for educational programs and prevention programs, as well as to keep our medical clinics continuing their good service and their extra demand in Pakistan. I just wanted to note that, while a great deal of our funding comes from governments and from some of the multilateral agencies, we really depend a lot on our private fundraising to help support the gaps in funding. Sometimes governments want you to do a project, but they won't give you all the money that you need to do that project. And also, they're very, very reluctant to help fund the kind of monitoring, evaluation, and management that we need to do that responsibly. And so those private funds help us both with serving the refugees and the migrants that are getting directly helped that are partially funded by government programs, but also helping us to be creative, to do new things that governments might not allow us to do, and also to respond more quickly in the emergencies. Governments take a long time and expect big, long, complicated funding proposals, whereas, the private fundraising helps us to be much more nimble in our responses, especially in emergencies like COVID-19. What can you do? Certainly, we'd be very, very grateful for any donations that people want to send to us. And again, we have good information on our website on how to do that, and also to make electronic donations to us. And then, and then the major gifts, we certainly would appreciate those as well. And please feel free to contact the people in our Boston office, or to contact me directly to discuss the opportunities for any kind of donations that you would like to make. And I think you will find our email addresses on our website.
Yeah, well, thank you, Monsignor. As the Monsignor said, there are a lot of different ways to connect with us and reach us, be it learning a little bit more about what it is that we do, or following up to ask a question. So you can email myself, Bill Bagley. We are in the fundraising office in Boston at development@icmc.net. You can send questions there about today's webinar if you have any outstanding questions, and we're happy to answer them or forward them along to the Monsignor for a response. You can also follow us on Facebook and Twitter. We can be found at icmc.migration on Facebook, ICMC_news on Twitter, and then we're also present on YouTube and LinkedIn. For more information on specifically our COVID response, you can visit us at www.icmc.net/COVID19. Again, that's www.icmc.net/COVID19.